Welcome to Autism Insights MD. I'm Dr. Matta. My mission is to provide a clear, objective, and simplified information regarding autism spectrum disorder. I will discuss about early signs of autism in toddlers today. I see a lot of toddlers, older children, and young adults in my practice, and I can tell you toddlers present a big challenge in autism evaluation and diagnosis. This age presents us with a unique opportunity to understand the foundations of future social reciprocal behaviors and what can be changed at this age. My presentation today is divided into three parts. First, I will talk about normal toddler milestones first, then joint attention behavior between the toddler and the parents, and then finally early signs of autism in toddlers. And all this is for educational purposes only and does not amount to the medical advice. What is autism? Autism is a neurodevelopmental condition characterized by difficulties in social interaction and communication, repetitive behaviors, and sensitivity to change and stimulation. And sometimes these kids may have some of the motor difficulties. Autism is a spectrum because it may present differently in different children and may show a wide range of strengths and challenges. And I also personally believe it presents a lot of unique strengths and opportunities at the same time. So let's talk about the normal milestones in the toddlers first, 1 to 3 years old. It's so important to understand what is normal before we talk about what is not normal. The range of normality is so complex and wide, like the spectrum itself. I tell the medical students on a daily basis that if you can figure out what is normal, it's so easy to figure out what is not normal. And I hear the same thing from the first time parents who often say that they don't know what to expect with their first baby as far as the milestones are concerned. I will focus on two groups of milestones today: language and communication and social behaviors. Let's look at some of the milestones in this age group. So when talking about the milestones, I will focus on speech and then the interaction between the toddler and the parent or the caregiver and the evolution of pretend play or symbolic play. By 12 months, a child can say 1 to 3 words in addition to some other bisyllables like mama. They imitate their parents' sounds and smiles. They point to things with their index finger and look where the parent is pointing at. They play social games like peekaboo. A 12-month-old toddler is focused on himself. They pretend to sleep, eat, or drink, what we call as self-pretend. By 18 months, they can say 15 to 20 words. They may use two-word phrases. Now they start imitating the words. They point to show you something interesting, and the child will look back and forth between the thing and the parent to make sure that the parent is engaged. And that's the other dimension which gets added at this age. As far as the pretend play is concerned, now they start doing simple actions on dolls and stuffed animals, like feeding them or doing their hair, what we call as a simple pretend play. By 2 years, they can see at least 20 words, and they combine two words together. So 2 years, two words. They start imitating the parent. So they start by imitating the sound, then the word, and now the parent. The pretend play now progresses to imitating daily activities which the parents are doing, like sweeping or cooking, what we call as the familiar pretend. They point to things in a book or iPad when you ask a question. A 3-year-old can combine 3 words. They can converse with you 2 to 3 back and forth exchanges. So 3 years, 3 words. The pretend play, they can now pretend that an object is something else, like a banana is a phone, what we call as object substitution. And they show early imaginative behavior. As you can see, all of these milestones require an interaction between the child and the parent. And that's what we call as joint attention. I will briefly talk about joint attention, which is the second part of the presentation today. So joint Attention is engaging in back and forth social interaction between the child and the parent by exchanging facial expressions, sounds, and gestures. So when you smile at the baby and the baby smiles back, what is called as a social smile, it's an example of the joint attention. Social smile is a very definitive milestone by 2 months of age. If a baby has not had social smile by 2 months of age, the baby should be monitored very closely in my experience. So, joint attention is a stage in infant parent interaction that facilitates social learning. Joint attention can be of two types. A child can initiate an interaction by way of gesture or eye contact, which is called as initiating joint attention. Or a child can follow parents' gaze or gestures in order to share a common experience, what we call as responding to it. So, when does it start? Joint attention starts as soon as the baby is born and it goes through different stages. Babies come ready to explore, learn, and respond. A quote by Laurie Wismara, PhD. She refers to it as attentional flexibility. A baby can interact with the parent in a lot of different ways by crying, babbling, smiling, eye tracking, gestures, and later on words. These are all examples of similar exchanges. So, what does joint attention has to do with autism? Autism is characterized by chronic and pronounced impairment in joint attention, especially in initiating joint attention rather than in responding to it. Also, differences in the degree of these exchanges may affect the intensity of the social symptoms, responsiveness to interventions, and long-term social outcomes in children with autism. And that brings us to the last segment of this presentation. What are the early signs of autism in toddlers? Now, I will divide these early signs into three broad categories in the context of what we have discussed so far. The first of that relates to language related. Second category is social behavior related. And then the third category is the stimming behaviors or the self-stimulation behaviors. Most toddlers in my practice, they present with language delay. That is the main concern with which they are brought in, or with some repetitive behaviors like hand flapping or sensory sensitivity. When we talk about the language-related red flags, we are focusing on the words in the nonverbal language. The nonverbal language refers to eye contact, pointing, and words and gestures together and facial expressions. So these kids, they may have delay in spoken language. They may not make good eye contact. They may not point to things or make a request. They may not respond to their name when you call them. They may not smile in response to your smile. They may not use common gestures, or they may not use words and gestures at the same time, and they may not use facial expressions. Coming to social behaviors, which can be a red flag in a toddler, social reciprocation is a critical foundation and determinant of future social behavior and has immense influence on how we behave socially as we grow up. So these toddlers, they may not interact with the caregiver by babbling or by using words. They may not smile in response to your smile. They may not try to engage with you, show you a toy, or share when they're excited. They may not enjoy cuddling as much, and they may not show interest in or play with other children. They may just play by themselves, what we call as a solitary play. And the last category of these red flags, the stimming and the self-stimulation behaviors, can be in four different categories, broadly speaking. They can be in the form of repetitive behaviors, like the body movements, like hand flapping or spinning, sounds or words, what we call as echolalia, and they may have repetitive play with toys. They may babble or talk words in an unusual tone. They may have intense or unusual interest. They may be obsessed with a certain toy or object, and they may carry a random object around like a spoon or a can. They are usually resistant to change. They may be difficult to soothe, and they may have difficulties in transition when going from one thing to the other thing. They may have sensory sensitivity to sound, smell, texture, or touch. But at the same time, it's important to emphasize that autism is a spectrum, so expressions of it vary from child to child. Also, toddlers are constantly changing and showing new behaviors, what we call as emerging behaviors, which were not there a few weeks back or a couple of months back. So it is important to monitor them closely. In milestones, in most kids with autism, motor milestones like sitting, standing, or walking may be achieved at expected times. Some toddlers may regress or lose the language or the social skills they previously had. Recently, I had a child in the clinic referred from a school due to hand flapping only when he's excited or is trying to focus. Having an isolated behavior does not make the child to be on the spectrum. It is a cluster of behaviors coming together, what I call as horizontal migration, which has to cross a threshold to be on the spectrum, what I call as vertical migration. So to summarize, I talked about what to expect in a normal toddler from language and social behaviors point of view, and what is joint attention and its role as a stepping stone for future social behaviors and early signs of autism in toddlers. I encourage you to monitor your infant and toddler for these early signs, watch for emerging behaviors, and most importantly, stay engaged with your toddler. It's fascinating to watch them grow. So how can you monitor your child? I will talk about it in a future presentation coming soon, so stay tuned. If you are concerned, contact a medical professional. Until then, like, subscribe, and follow at Autism Insights MD, empowering neurodivergence together. And thank you so much.